Hi, good morning. Welcome to another edition of Eat This, Lose That program. Today, you're going to be watching the second portion of the foot series. In this part, you're going to learn more about strain and sprain of the foot, flat foot, and fractures. I want you to pay attention, and as you watch, as questions come into your mind, please send us your questions at info@reddycardiology.com. Based on your questions, we will ask Dr. AK and get his answers and post on the web. Thank you.
What is a sprain? A sprain basically is a tearing of the connective tissue or the ligaments. Okay, you can and the sprains generally are graded according to the severity. Most people usually get grade 1 or grade 2, which means the ligament does not completely tear, only partially tears.
It's stretched.
It's stretched, a lot of it's stretching and it tears. The bad part about strains versus the bones breaking, strains take longer to heal.
So before I say, strain and a sprain, is it the same?
Same thing.
Okay,
strain
and sprain is the same thing. And strains take longer
to heal
than the bones. I thought it was the other way around.
No. The ligaments always take longer to heal.
So you have to be careful when you're lifting weights not to tear the ligaments or strain the ligaments.
That's right. If you don't damage the ligaments, you're much better off, okay? Because when bone breaks, bone has got a very specific healing pattern, which they all follow.
So similar healing pattern, okay.
Okay, and generally speaking, bones will heal anywhere from 8 weeks on, 8 to 12 weeks, they're completely healed.
Got it. Okay.
Okay. Soft tissue will heal, but usually takes 10, 16 weeks for it to heal.
10 to 16 weeks.
Yeah, it'll take longer. And the other thing, of course, when we talk about healing, we're talking about bone just joining back together, okay?
Right.
It is still, then what happens is bone goes through a process called remodeling.
Okay.
Now the whole bone is completely taken down and redone along the lines of stress. Your whole skeletal system is modeled along the lines of stress. And when you look at x-rays, you see what looks like faint lines in them.
Mm-hmm. Yes.
Those are called trabeculae.
Right.
Okay, and those trabeculae are what? And if you ask an engineer, where is the weight going to go? It's going to go along those trabeculae. That's what transmits the weight down. Oh. That's what I'm saying. The man upstairs knew exactly what he was doing.
What he was doing. Wow.
Okay, so that's the fractures, and that fracture is different from sprains. That is the reason. Okay, that there are different fractures that can happen in the foot. Toe fractures can be a real nuisance in that.
Why?
They're usually painful.
One.
Because every time you walk, you hit that. It hurts. And most of the toe fractures can be managed very conservatively. You don't have to get very fancy. And usually what we do for most toe fractures is, unless the displacement is gross, we usually just tape it to the adjoining toe.
And then it heals.
And it'll heal, because all that is, the adjoining toe acts like a splint, holds the alignment. We talked about alignment early on.
Right.
It holds the alignment and it'll take its time and heal. But of course, in this day of high contracts, big contracts in professional sports, they have to go ahead and fix them, try and get them to heal faster. It doesn't heal faster. Only thing is, these guys grit their teeth and go and play with pain.
Wow.
Because the bone is not healed completely, but the healing process has gone through. Okay, basically what happens when a bone breaks is you get a lot of blood there.
Yes.
Okay. Like everywhere else, the blood now is reorganized.
Okay.
And you get fibrous tissue being laid in it. So now the bone doesn't move as much. Okay. Most of these professional athletes, when they come back to play at 8 weeks, That's the stage they are in.
Right, at 8 weeks. They're not fully healed.
They're not fully healed. So if you hit them, it'll still hurt because it's not completely healed. But I guess, if you get a $40 million contract you're supposed to take the pain.
That's right. So they get back into action.
They get
but
back.
Any risk of breaking it again?
Is high.
Is high.
Yeah.
But after 12 weeks, it usually comes back to its original strength?
No, it will take, then a remodeling process takes anywhere from 6 to 8 weeks after that.
After that?
Yeah.
So you're essentially looking at almost 18 to 20 weeks for a full recovery of the bone.
You're looking at about 6 months on the average for any bone to completely heal.
Heal. Ah.
Okay. The foot, of course, the problem is when you get these fractures, if the fracture is close to one of these joints, and the joint doesn't get back its pre-injury status, then the arch starts to sag.
Tell me more about the arch. So
the arches, you have longitudinal arches which start at the heel and go all the way to the foot. To the toes.
Right.
And then you have some horizontal transverse arches.
Okay.
They, between the two of them, they give you the support. Plus you have the arch that you can see. Now people say when you have, I've got the army actually made it famous. They said if you had flat feet, you cannot be in the armed forces. That's a bunch of bull. Okay.
Really?
Yeah.
So because
if you look at 100 people off the street, you probably will see about 25 to 30% of them will have flat feet.
That's high.
Yeah, 30% have good arches, and another 10-15 have a combination of these two.
Flat and reasonable arch.
Yeah, and that's the way they were created, and they can do just about everything.
Now these people with flat feet can also run, exercise, lift weights without having to worry about future problems with arthritis because their alignment is gone.
Flat feet will lead to arthritis. That is because of the alignment problems, okay? But that doesn't mean that you cannot do the activities. Okay? If you have good support arches and supports and shoes, you can usually stay pretty active.
So let's say a question from the audience will say, hey, I have flat feet. What do I do? Should I go and see my podiatrist or an orthopedic surgeon? Should I get special shoes for it? Should I wear shoes with arches? And what sort of exercise am I limited to?
There is no limitation of exercise. Do whatever you can without pain.
Good.
Okay, pain is the first criteria. If it hurts, the body is trying to tell you something. Okay, if it hurts, don't do it. The other thing, of course, is arch supports. Yes, they do work, but they have to be made right.
So it has to be custom.
It has to be custom made, and for a custom made arch support, it'll cost you a little bit of money. Because they basically have to take a cast of your foot, take a mold, and then make the arch support for that mold. Okay, and that costs money, and there's labor involved.
And that you have to wear for the rest of your life.
Yeah, that's something you should wear
for the rest of your life.
If you wear it, you won't have too many problems. If you don't wear it, and basically what we tell, especially women, because when they come and say, I got flat feet, my feet hurt, you get them arch supports, you always tell them for the first 3 to 4 weeks you're going to hurt like hell.
It does hurt a lot.
Yeah, because the foot is not used to being with the supports. Now you put all these supports in there, and then the foot has got a new position, so it's got to get used to that position, and that takes
That's painful.
It's an adaptive process, and that takes 3 to 4 weeks usually. And once they get used to it, they'll say, why didn't I do this before?
Really?
Because it makes a big difference.
So people who are watching this, please, if you know of someone who has flat feet, please have them see their podiatrist and ask them to get,
or an orthopedist, but usually you'll need arch supports and a heel. It's a specialized arch support that they make for these. And that should give you a lot of relief.
And prevent future problems.
Yeah, and it should cut down on the future problems. The only biggest problem we have with this is all these arch supports need closed shoes. Okay, that is the only drawback.
And so the drawback is closed shoes, and second is, can the people with flat feet wear heels, and what happens to them when they wear heels?
Their foot is definitely not designed for heels.
That's it. So if you have flat feet,
do
not wear heels, because you're only asking for trouble.
And if it hurts, it hurts. And then, but if you say, look, I'm going to this ultra gala that I have to go, and my black dress doesn't work with this flat shoe, I have to get the 6-inch heel. Now take your pick. If you're prepared to put up with the pain, go right ahead. More power to you.
But at the end of it, go back to flat feet again.
Yeah, because you do that, and you come back from the party in 2-3 days, you're going to be hurting. so
I guess it's good to be a male where you don't have to wear high heels and you just walk around. And for us, all you have to do is make sure your soles are rubber heels. That takes the cushion. Or the other one you said was?
Crepe soles.
Crepe soles. So crepe soles are rubber soles, that goes a long way. But women who are listening and watching to this, please, if you have flat feet, try not to use high heels, because you're only going to hurt yourself. I've also seen some women, because of, I don't know if it's because of wearing heels or high heels or the type of shoes they wear, their toe actually goes on to their second toe. What is that?
That's because the front of the shoe is made tight, okay?
Oh.
All that is, again, a designer thing. All these shoe designers make these toes kind of like sharp and this thing. But the human foot was not made to be sharp.
It's supposed to be flat.
It's supposed to get the room.
So
that's
now
why
it's like the Chinese shoe paradox. You shove the foot in there.
Yeah, you shove the foot in there, and naturally you keep that covered like that for 4 hours, you're going to hurt.
And then your toe is going to start climbing on the second toe. And it's going to be ugly looking when you are off the shoes.
Ugly looking, and then of course, then you go to the podiatrist, he rubs his hand and he says, great, now I can operate on you.
But still after that you can't go back to heels.
No, you can't go back to heels.
So please protect your foot. So why is this so important? So you talked about arch, you talked about heel, and what about the toes? How do I protect my toes? Keep them loose in the foot so that
you should have room for the toes to move inside your shoe. Okay, they should not be tightly held in place. They should have room to move.
So Dr. Ananthakrishnan, you're telling me the best way to protect my feet is to wear ugly shoes.
It's not, I wear white shoes. I always wear
white shoes.
Yeah,
okay.
White, because I don't like pain. Okay. All right.
I wonder why you are in the minority.
But I don't like pain, so I just shoes. They're doing a job. They're just to cover my feet. That's all that they are.
That's what it is. So it's not a fashion statement.
So for me, it's not a fashion statement.
So why is this so important? Why should I pay so much attention to the foot? Is it because if my stance is right and my feet are aligned properly, my spine, my hip, everything falls in place?
Well, if you have a normal, the rest of the joints are all normal, and you have a good stance, then everything will fall into place, okay? Because the foot, that's where the weight transmission comes through. Now, if the ankle above it is abnormal, it will not transmit the weight properly.
Okay.
So it's not the foot's problem, then the ankle is going to give you trouble. Okay, the ankle comes above the foot, remember.
So if the stance is not proper, it goes to the ankle.
It will come up to the ankle, the next joint. It just keeps moving back up, the link system.
And I remember once in a while when I do something wrong and don't do the right thing, I develop gout. And when I have gout in my foot, it becomes extremely painful. And I realize that the knee and the hip, everything are offline. They start hurting because my walk has changed.
Yeah, gait, if you change your gait pattern, other joints will start telling you. Now, gout, we all realize, as you all realize, is a metabolic thing. It's got nothing to do with the architecture of the foot or anything. It just happens that you have too much uric acid, and that gets deposited in the joints, and the sites, why does it go to the big toe? We have no idea. It's just one of those things that I guess either he wanted to leave you a reminder saying that if you drink too much and eat too much red meat, then
you're going to pay for it.
I'll make your big toe hurt. So right. Every step you take, you'll be reminded.
And trust me, it is very painful. And especially if you suffer from it for a month, it's nothing but pure torture for a month in a year.
See, in the foot, you don't generally get too much of the sprains or the thing. Sprains usually occur at the
ankles,
at the places where there are major joints. And when I say major joints, I mean joints where there's a lot of movement. Okay, the joints of the foot each by itself doesn't have a lot of movement.
Okay, so joints of the foot don't have that much movement. Okay,
because they have a lot of joints there,
right.
So they make up for all the different things. Okay, except what's called the subtalar joints, which are the joints below the ankle. These are joints there. They're the ones which you have to have a fairly decent subtalar joints for being able to walk on uneven ground. Because when you walk on uneven ground, they're the ones.
There should be give and take.
Yeah, they accommodate for that. Okay, so if you when people fall from heights, when they break their heel, because that joint gets destroyed, and that becomes very painful over the years.
So once the joint is destroyed,
nothing.
You can't restructure it. You can't reconstruct. You can't create an artificial heel. You can't create an artificial.
There's no artificial heels yet. The subtalar joints, basically what we do is basically a fusion, which means we close the joint off.
Then you can't have the movement.
You have the movement because the ankle is still free.
But
it's the only thing you'll have a little bit of a rough time on walking on uneven surfaces because the foot cannot accommodate. So that's about all, and basically as far as the foot is concerned.
Thank you for joining us on this Eat This, Lose That video newsletter. I hope you enjoyed it. I certainly did doing this. Now, if you have any questions after watching this, please forward us your questions at info@reddycardiology.com. Based on the questions you ask, we will create more video newsletters and post it for you to watch. Please follow us on Instagram, Twitter, YouTube, and like us on Facebook. And if you like what we are discussing, please forward this to as many people as you know. Our goal is to target 1 million people. Thank you.